Hello everybody. Today going to come with another healthy talk. It is about sleep problem of kids, and I think it is quite common everywhere. So I'm just going to start with a little bit today, and I will gradually then discuss every week a little by little, so increase awareness about it. So one of the most common problem that toddlers and young children are sleeplessness, means cannot sleep. The child may find difficulty settling to sleep and wakes in night and wants a parent. So it is also matters that how much sleep your child need. Every child is different, but approximately in a general rule of thumb, toddlers about 12 to 14 hours, preschoolers 12 to 11 to 12 hours, school ages 10 to 11, and teenagers maybe 9 to 10 hours, but it may vary. It can be a little bit less or it should not be grossly different. So sometimes, why cannot my sleep? That is really can be a question. Why my child is not sleeping? Very young childs have fear that left alone at night, and it is called separation anxiety. It is a very normal for ingold age. And bedtime fear. Many young childs are afraid of darkness. And of course, sometimes too much napping is not good for children, and that can cause a problem on sleeping. And also, I am not sleepy. You might find that when child gets very tired, they become irritable, aggressive, even overactive. So basically, overtiredness can also that. So sometimes you feel that daytime sleepiness. This can simply because child are not get enough sleep at night. They could not going to bed too late. Could be that going to too late or problem during sleeping. So less common reason is that sometimes there is some pathological underlying cause like tonsils and adenoids in the back of the throat that can cause the breathing difficulty, and that is the cause that child may get up repeatedly in the night, and the child may not remember waking up, but you may notice that they snore badly and sleep restlessly. This is called obstructive sleep apnea. Then there will be need the ENT or ear, nose, throat intervention to remove this tonsil and adenoid. And also there are some restless leg syndrome condition where child complains of crawling feeling and growing pain in the legs, and that make them want to keep moving them and stops them getting to sleep. That is another problem. Narcolepsy is an unusual condition. It causes unpredictable attack of sleep during day. People with narcolepsy may also have sudden attack of weakness. That is called cataplexy. And of course, in teenagers, drug and alcohol misuse we have to think about. And also, child with has depression sometimes that can cause also daytime sleepiness. And of course, nightmare. You have to most childs have nightmare occasionally. They be frightening dream, and usually remember the dream and will need to be comforted so that they can be back to sleep. Nightmare can also caused by worry, nasty accidents, or bullying, or by abuse of some kind. You can help by encouraging your child to talk about the dream and draw a picture of it. That will help find out the cause of upset and work out what support you can give about it that child needs. And of course, that is another problem, that night terror, most commonly between 4 to 12 years, different from nightmare and anxiety related dream. Unlike nightmare, it happens young child an hour or 2 hours after falling asleep. First sight, child is screaming uncontrollably and seems to awake. In spite of appearance, your child is still asleep. They will not be able to recognize, very much confused, unable to communicate, and it is usually hard to reassure them. It is best not to try and awake them, but sit with them until the night terror passes, usually about 5 minutes. Try not to feel upset yourself. It can be very distressing to see your child so disturbed, but they will not remember it in the morning. And children usually grow out of it. So this is a few things I today discussing about the spell. I think we will discuss further about it in the next session. Hopefully this will give you some of the awareness about child sleep problem. Have a good day. Bye for today.